This show is all about interviewing interesting people and learning. And sometimes when you hear stories about heart health on the news, frankly, the information can be boring. Sometimes it's pretty obvious, right? You hear a doctor say that you need to eat healthy. Like, duh, we know that, right? But Dr. Jeremy London is proving that you don't have to be boring when you're talking about heart health. He has millions of followers on Instagram and on TikTok. He has a newsletter now that is free, and he is a board-certified cardiac surgeon. And from the moment I saw a couple of his videos, I knew that I wanted to interview him, and he is joining me right now. Dr. Jeremy London, thank you so much for coming on the program.
Well, thank you so much. I don't know that I've ever been introduced as not boring. I'm going to roll with that.
Yeah, tell your boys that, right? So before we talk about just kind of some of the social media content that you're putting out there right now, how did you get involved in the medical field? What inspired you as a 20-something-year-old to take that route?
Well, actually, it started well before I was 20 years old. It started when I was about 15 years old, and I started scuba diving and working in a scuba shop. And I ended up being a dive master by the time I was 17 or 18. And I loved to dive, but what I really loved was the first aid and rescue portion that I was learning as a result of being a dive master. And after that, I ended up working in an emergency room and kind of getting some patient contact. And from that point forward, I decided I wanted to be a physician and decided that I wanted to go to medical school and be a general practitioner in the mountains of North Georgia, where I was the only physician around for 200 miles, getting paid with chickens and delivering babies in cars. And that didn't happen at all. I went the whole other end of the spectrum. But that's kind of how it started. So
when you were kind of going through general surgery training, you saw someone else, a surgeon, is my understanding, deal with a ruptured aneurysm. And that kind of got you thinking, hey, this could be the route that I want to take. Is that right?
Yeah, I totally pivoted. It was actually as a third-year medical student. I was just on a surgical rotation, and I was working at one of the VA hospitals, and I was the only one around in the evening to actually help this vascular surgeon with a patient with a ruptured aneurysm, and operated with this guy through the night. And the patient survived and did really well. And I left the operating room and I said, that's what I want to do.
Wow.
And just totally pivoted. And from that point forward, shifted towards general surgery, where I said, I'm not sure what kind of surgeon I want to be, but I know for sure that I don't want to be a cardiac surgeon. And so then in my third year as a general surgery resident, I rotated on the cardiac service, and literally after my first open heart operation and seeing the human heart and stopping it and helping someone work on it, I was converted once again, and that took me down this pathway. All that being said, when I asked my mentor, who was a cardiac surgeon at the time, I said, look, I really want to do cardiac surgery. What advice do you have? And he said, listen, if you could be happy doing anything else, go and do that, because this is a tough road. And he was certainly right about that, but I've never looked back, and very satisfied with my decision.
You know, we have the Mayo Clinic here, a branch of the Mayo Clinic in Phoenix, and you know, world renowned, and Scottsdale too. People come in from all over the world to get care here. And I've interviewed, frankly, a lot of surgeons, and you had said that you felt like, you know, heart surgeons were kind of jerks. So you had that perception. Why is there that perception that they're jerks?
I think that clearly when you look at some of the higher risk specialties like cardiac surgery and neurosurgery, there is an ego piece to it that if we didn't all admit it, we would not be honest. And that's certainly, particularly in the old school surgeons, that was, I think, kind of a primary motivator to end up in some of these specialties. But a lot of it too is, I think, because every time we walk into the operating room, there's a 1% to 2% risk of patients dying, that we all have a little bit of an attitude and have a certain expectation that things are going to be a certain way. And I think that those edges have softened over the years. I think the old school training that I got the tail end of is really not around anymore. It was pretty harsh.
Yeah, and of course I'm not saying that, the guys the men and women that I've interviewed are that. I'm certainly not saying that at all, but I thought that was interesting, something that you'd said earlier. When you started kind of going the social media route, because that's kind of where you are known now. I mean, obviously in Savannah and where you live, you are known for what you do, but on social media now, it has opened up a completely new world for you. When did that start, and who encouraged you to do that?
Yeah, it's been a really unexpected journey, quite honestly. I mean, I think, first of all, for me, for the last 25 years, obviously, I could only take care of one patient at a time, whether I'm seeing him in the office or whether I'm operating on him in the operating room. What I do is not scalable. So social media really has given me this opportunity to reach millions of people at one time and impact so many people. But the backstory to all of this, quite frankly, is my son, who is now 27, has been in the social media space since 2017, has been begging me for the last, be 4 years now, to step into this arena. He kept saying, Dad, I really think this would be a good fit for you. I think you'd be really good at it. He's worked with other physicians and was like, look, this is perfect. And I just basically said, no one cares what I have to say. His name is Max. I was like, Max, no one cares. No one cares. He said, Dad, you're wrong. You have a perspective on things that people would be really interested in. And he got really frustrated with me about a year ago, right now, actually, and said, look, you think that social media is toxic? I said, yes, I do. And he said, that's fine. Why don't you quit complaining about it and do something positive? Well, what am I supposed to say? No, I don't want to do anything positive. I was like, okay. And then he softened a little bit. He said, look, give me 30 days. I need your full engagement. I want you to post every day, and I'll help you. I'll help direct you. If after 30 days you don't enjoy it, we don't get traction, we shut the whole thing down. It's social media. No harm, no foul. It is no big deal. He goes, that is not what's going to happen. I promise you. But give me 30 days. And here we are now. It's been an absolute meteoric rise. I mean, after 3 weeks, we really had that inflection point with one post that we did on vaping. And it has just been crazy ever since. It's like every week it's a new layer for us of growth. And, our mission is really just to get high quality, digestible, relatable information about health, wellness, and medicine to anybody with internet access. And that really is our goal every day. And in spite of all of the followers that we've been so blessed to amass, our mantra is, today we have 0 followers, and let's do something we're proud of.
You talked about the vaping video, and I've seen, a number of them, and I think he knows what he's doing, because, one was like, it had like over 7 million views. It was seemed simple, but it was the 4 things I avoid as a heart surgeon. And if you see that, you're a heart guy, you're going to click on that because you're going, wow, if this guy is this heart expert, I want to know, what is he going to avoid that will make me healthier, make my life better. And I think we're kind of obsessed right now with longevity, living longer. You guys have tapped into this thing that a lot of people care about, they want to learn about. With social media, I use it to learn. It's just a valuable tool that you can learn a lot.
I think it really has become the channel for information in so many aspects. I mean, look at the last election as far as how much information was transferred through the social platforms. And you're right, people certainly look towards social media for lots of information. And the health, wellness space and longevity space can be overwhelming. It really is like drinking from a fire hose, and it's hard to find high quality, supported information, and from people that are actually trying to live it in their lives.
Yeah.
And I think that one of the things that we really try to maintain is that we all have our own instruction manual. You know, yours is going to be different than mine, and I'm going to give you information that may have worked for me or very general information, but ultimately your body, your rules, like you're going to make the decision, you know, as far as picking and choosing which levers you want to pull or work for you to improve your health span and lifespan.
Mm-hmm. I wanted to ask you about the number one screening that folks listening right now could use at home to determine their cardiovascular risk and what that is. And I don't know if you have to go into, to a doctor to have it. It's the calcium scoring, is that right? The CT scan. What is that, and how can that benefit people? And like
Sure.
what age too are we talking?
Yeah. So the reality is that the recommendation would be after age 40 if you look at the actual recommendations, but there's a lot of patients that come in even younger, patients that have family history or they're just concerned. But the most common age group would be kind of that 40 to 65 plus into 70-year-old individuals. And what this does essentially is it's an X-ray, it's a CT scan, doesn't involve any dye or anything of that nature, and it's a very low dose of radiation. And it's a screening test, mind you. It is not a definitive test, and we'll talk a little bit more about that in a minute. But what it does is it quantifies the amount of calcium buildup that you currently have in the heart arteries. And it rates it anywhere from 0, being totally normal, to typically greater than 400 or 500, which is very abnormal. Now, if you end up on either of those ends of the spectrum, then the next steps are very easy. Obviously, if it's 0, then you can rest assured that you have a very low cardiac risk. If it's at the very high end of that spectrum, then that typically requires a true dye study or a cardiac catheterization where dye is placed directly into the heart arteries, which then creates a roadmap to identify if important blockages occur. The more confusing or gray areas, if you fall in the mid zone, the gray area where it's not normal, it's not entirely abnormal, and you don't have any symptoms, what do you do next? Well, all of that depends on what your overall risks are, but typically speaking, the next step would be a stress test. And that can come in several fashions, but the most common would be to get on a treadmill with EKG pads with graduated speed and incline. So in other words, slowly working harder and harder on the treadmill to see if you could induce any symptoms of chest pain, shortness of breath, or EKG changes. Why is that important? Well, blockages in the heart arteries are typically symptomatic problems. In other words, if you have a blockage in a heart artery and you exert yourself and the heart is beating harder and harder, the area below that blockage becomes blood starved, where not enough oxygen and nutrients are getting to that portion of the muscle. So as a result, you start to have symptoms, whether it's chest pain, shortness of breath, the classic chest pressure down the arm or into the jaw. It can be very subtle findings, things like indigestion or reflux type symptoms. But the key is that they're brought on with exertion and then relieved with rest. So if you're not having any of those symptoms, the screening test is nice to be able to put you into these categories so that you can delineate whether or not you need further testing to then potentially pick up blockages of this nature before symptoms and problems occur, like a major heart attack.
I'm assuming that a lot of women don't do this because we know that the number one killer of women is heart disease, right? And I go in for a physical. I think a lot of women do go in for a physical, but I don't know necessarily that heart health is going to be on their mind necessarily.
Well, that's interesting that you bring that up. I mean, first of all, I will tell you that in general, women have much more common sense when it comes to their health care than men do. We tend to fall into the denial category much more quickly, in my personal experience. And it's interesting that you bring up women in particular when it comes to heart disease, because yes, it is the number one killer of both men and women, but women typically can present differently than men do, and many times women's symptoms are kind of brushed to the side as being anxiety or irritable bowel syndrome or things of that nature that are not directly related necessarily to a standard complex that we would associate with cardiac problems. In addition, with now all the data with perimenopause and menopause and the effects of estrogen as being protective as an anti-inflammatory in our body, as well as helping to prevent calcium and cholesterol buildup in our arteries, it is becoming much more the forefront in the minds of folks that are evaluating women for cardiac problems than it has in the past. And I think that there's been a huge public health push to engage women more openly that they need to be screened exactly the same way as men are.
When you talk about calcium, is that different than plaque?
Same.
Okay, it's the same. Okay. Another video that you had, 4 tips to avoid ending up on a heart surgeon's table. Same thing, you know, you just have 4 things, people are clicking on it: eliminate processed foods, move, obviously aerobic exercise, limit or remove alcohol, and then solid sleep. I mean, that is pretty basic. And you're a big proponent of lifting weights. And we always hear, watch what you eat healthy, and move. But you're saying, hey, we got to strength train, and I think that kind of gets lost sometimes.
The reality is it's a combination of both. If we look at, you know, what moves the needle most significantly as far as our longevity is concerned, it's 2 pieces. It's aerobic training, because VO2 max, which is just a measure of how efficient our cardiovascular system is. So of course, if your heart is working more efficiently, then it's not going to be under as much stress and strain, and as a result, hopefully work longer. So having a high VO2 max or a high efficiency is a direct correlation to health span and lifespan. But it alone is really not enough, even though if you weigh these two, certainly the VO2 max outweighs the muscle mass argument. Really, both of these things together are exponential as far as the quality of our life, our health span, and our lifespan. Why? Well, muscle is, number one, from a functional standpoint, as we age, is important for our stability, to be able to get down on the floor and get up, to be able to, you know, continue to do the things we want to do. But more importantly, muscle burns glucose very efficiently in our bodies. So if you have a high muscle mass and you have extra glucose, our muscles, even if we're not actively exercising, will actually burn that extra energy before it gets turned into fat, which helps prevent insulin resistance, getting that extra mid-gut fat, which we know is a sign of increased risk for heart disease, as well as this metabolic syndrome that most of us hear about on a regular basis. But backing into it, you know, first you have to think about what you're putting in your mouth.
Yeah.
Because before you do your first sit-up, before you go out for your first walk, run, and buy a expensive gym membership or get a trainer, you have to really think about your diet and your diet strategy, because you can out-eat any exercise that you do.
Yeah, absolutely. We even had a story the other day on the news, and this person's like, you know, you need to eat healthy. And I always say, like, yeah, duh, we know that. But 2, you know, what are the things that are better? And I think for some of the things that you say, you know, you specifically talk about diet soda and soda. What's bad, what's good, you know, hey, sure. I'm not going to tell you, you know, what to do, but I am going to tell you that there's all this stuff in there, and hey, that can increase your risk for stroke and for heart attack. And so when you have that knowledge, I think it does make you think a little bit before you are, you know, putting it in your mouth. It's just a fact. It does make you pause a little bit. Something that came up too is that you yourself, you work out all the time. I will say too, you don't necessarily fit the mold of like a typical heart surgeon. And I think that's probably why your sons also saw like this great potential on social media. You know, you have a Southern accent, you're hunting, you're working out, but you also had a heart attack. And I think that you're a great example, and I can relate to this because my husband also had a heart attack, and he's a healthy guy, and it rocked our world. And you've talked about that, how it also rocked your world, your family's world, because you never thought that it would happen to you.
Yeah, for sure. Well, you know, the old adage, we know better, but we don't always do better.
Yeah.
And I think that touches on many things that we've talked about already, like even when you talk about diet and like we know better what, you know, that we should avoid junk food, we should limit sugar and all these things, but we don't always do better. And I kind of had that penultimate experience with my, you know, cardiac situation because, you know, when I started having symptoms, I knew what was going on, but I wasn't willing to admit it to myself or to my wife at the time, quite frankly, you know, when it was going on. My youngest son and I were about an hour away, and my family had come back into town, and I had this event that I pulled myself out of, drove my son back into town, still didn't say anything to my wife. Literally went to bed that night, took an aspirin and a beta blocker, woke up the next morning, and immediately then got into real trouble. At which point, you know, I said, Tracy, you know, this is what's going on. I'm having crushing chest pain, and this is what happened to me last night. And she was like, let me get this straight. You had all of this happen last night. You drove my child back an hour and just went to bed. And she said, you know, this is the most selfish thing you have ever done to me and the boys. And I just said, you're absolutely right, and I'm really sorry. And said, oh, by the way, I'm having crushing chest pain. I'd like to go to the hospital now. I'm ready to go. And she said, yeah, why didn't you tell me last night? I said, because you would have made me go to the ER. She goes, yeah, that's what you do when you're having these kind of symptoms. And so my point is, obviously, you know, this is embarrassing for me, and I'm not proud of my decision making. But even someone like myself, that this is what I do every day, we can all convince ourselves, you know, denial is not a river in Egypt all the time. So, you know, we can always convince ourselves otherwise, and we're all prone to this. And so you have to really have some intellectual honesty about what's going on and listen to your body. And I was very fortunate. I can tell you that I woke up the next morning in the hospital so incredibly grateful. Like my whole world was reprioritized, as I'm sure yours and your husband's were as well. You know, that things that were important to you the day before weren't even on the list the next day.
Yeah, it's weird, and I've, you know, I don't talk about it a lot, but it was wild because he was 42, and it was funny. I told him I was going to talk to you. He's not on social media, but he was like, well, just make sure he knows that I'm not like, you know, morbidly obese. You know, he was like, he wanted to make sure. And what's crazy, so he was training for a half marathon at the time, 42. You know, he wasn't like rail thin. But, you know, relatively good health. And it was around Christmas time. We had our son at the time was 1, and I was anchoring the news, and I was getting some text messages from him. And, you know, it's Christmas, so it's kind of like, you know, the medical field, there's not a lot of people to work that week. You know, it's like people are on vacation, and I got a couple text messages from him, and I'm going, okay, this sounds like heart attack symptoms that we talk about on the news. And I said, well, you know, just call your mom. She has kind of a medical background. And so he did, and she said, get to the hospital. He was like, you know, crushing pain, chest pain, arm pain. And so he went to like this kind of, you know, community hospital, like a, you know, satellite. And this tells you kind of how I think insane we thought this was, but it did not even enter our brains, he then texted me or called me and was like, yeah, he goes, I think they're gonna take me to the big one, like the big hospital. And I, no joke, I said, well, what? Like, I'll take you on my dinner break, is what I said. And like, I mean, like it was,
That's awesome.
I mean, it was like, it just didn't even cross our
Computer.
minds that that
Yeah.
was actually happening. And he had a 98% blockage, like 98%. I mean, and that's what they said. They said, like, if he had run that race, or if he had, fallen asleep without maybe taking an aspirin or, whatever, I mean, it would have, it's like I'll get emotional about it, but because again, I really don't even talk about it at all,
I understand.
because it was like, a while ago now. But yeah, it was a 98% blockage. So, and he was a healthy guy, And, but it changed our life. And this was kind of funny too. I was like, you can't leave me, we have a little baby. Are you kidding me? Like, what are you doing? It's crazy. And, but anyway, come to find out, he had a very demanding career, traveling a lot, and was relatively healthy, but plaque. He kind of genetically, he would have plaque that would build up that maybe wouldn't build up in somebody else, that looked like him on paper. So anyway, yeah, but I think like I've told a few people the story about, hey, I'll take you on my dinner break, and we're just like, oh, like I'm like the worst wife ever.
No, well, I mean, it's not on your radar. I mean, and it's kind of the opposite situation for me. It's like, that's what my radar exists of, and I wasn't able to even, kind of step up until, things got so bad. But I'm kind of like you. Every time I retell this story, I get goosebumps thinking that, I was with my youngest son an hour away, and that could have been a devastating situation if something horrible had happened, in front of him or something of that nature. And it's just, we feel so blessed that we got on the other side of it. And you feel like you've been given a second golden ring. You really do.
Yep.
As I'm sure you guys do as well. And I can tell by how impactful it was that's definitely the case. And hopefully he's done well since, I hope.
Yeah. Oh, yeah. Yes. I mean, the stent, he has a stent. I think like you have a stent. And the two, I mean, medical, I mean, I'm sure what you have seen over time throughout, working in your field, that the technology has just like, improved so dramatically, where you're not necessarily having to cut people open all the time to have like an intervention and to save somebody's life, which is great.
Yeah. I mean, my stent was placed just through my wrist, actually.
Wow.
Didn't even have to go through the groin. I will say that, up until, even when I was in the procedure, I wouldn't let the cardiologist sedate me during the procedure, because I wanted to see what was going on and still wanted to remain in control of the situation. And, when he actually placed the wire across, because I had the same thing, a 99% lesion, it occluded the artery. And I immediately had crushing chest pain and abnormal EKG changes and all those kinds of things. And I was like, hey, buddy, I'm having crushing chest pain. And he looks over the drapes and he's like, I need you to shut up so I can get this done. And he immediately sedated me.
Yeah.
And after he was done and everything went fine, he went out to talk to my wife. He said, listen, I dream of stenting cardiac surgeons, but doing a procedure on Jeremy London was an absolute nightmare. And she looked right at him and she said, oh, I'm sure.
Yeah.
I'm sure.
Yeah, I'm married to him, right? She probably said. Yeah, I mean, so like, kind of moving forward too, do you see yourself, continuing to do this education? And you're saying I'm, pretending we're starting these days where I have no followers. And is that kind of the goal, to continue to educate and to continue to get kind of the message out about heart health and what you're doing?
Absolutely. Again, this whole idea that it gives me this opportunity to scale what I've been doing for the last, 25, 26 years now and impact so many people at one time that it's like a natural 2.0 version, if you will. I'm 58 years old and have been doing this a long time. And so I start to think, we all age out of whatever profession we're doing at some point.
Yep.
And this just gives me a very natural path as I look towards the next 2, 3, 4, 5 years to do something that I really, really enjoy. Plus, I get to work with my oldest son, and that has been absolutely phenomenal. As your kids get older, you can become less of a parent and more of a friend, which is great. But we are business partners together, and we think we're doing something really meaningful and really valuable. And to be able to do that with one of your kids, it's totally changed our relationship. It really has. It's been phenomenal. In fact, I would probably give everything else up just for that particular component because it's been so incredibly powerful, between the two of us.
Yeah. Has there been, I have asked this of other people, has there been any kind of negative? And whether, we always talk about comments, and I think too, if you're secure in who you are, comments really don't bother most people, I think, especially if you're secure in who you are. But has there been one negative that really stands out in your mind at all from this whole kind of, experience?
I'll make two comments. First is my son really doesn't like me to read the comments at all. He's like, don't go down that rabbit hole. Mainly because what happens is we're all affected by the negative comments. And there's people out there trolling all the time. And what the end result of that is you end up changing your content, trying to please a certain audience or certain individuals. And our goal is just to continue to create and document things that we're proud of every day. And along with that, there's going to be, positive response and negative response. And my feeling is if it was only positive, we really wouldn't be doing anything worthwhile. I think that one of the more difficult areas, particularly for a physician, is I tend to promote products that I actually use and believe in. And I definitely get a lot of criticism, from a financial standpoint or whatever it may be. But if I don't use it myself and believe in it, it's not something that I'm willing to promote.
Yeah, no, that definitely makes sense. What does your wife think about all this fame, your little social media fame? I'm sure she keeps you humble, honestly.
Oh, you have no idea. Yeah. So initially, I think it scared her a little bit, honestly. Maybe even both of us, because it was like, whoa, this is really a huge shift. I mean, you got to remember, I was the guy at parties that if someone took my picture, I would literally go and grab their phone and delete it and tell them I was in the witness protection program. Like,
wow.
For me to be, public facing is like dramatic. And so it's a huge pivot in my life. And so it kind of caught us both off guard to some degree. But now I think she realizes the value. She sees, that it's something really special for my son Max and I. And it gives me this runway into kind of the second curve of my life to do something that I can take all of this crystallized knowledge and experience and continue to utilize it in a meaningful way. And so she's incredibly supportive, and she's actually kind of a moral compass and a bit of a litmus test too, like as far as helping us evaluate content and working through problems. I mean, she just gives us a really good perspective on how women think differently than men and how things may be perceived and what have you. So she keeps us honest, which is great.
It's crazy when you talk about parties. Like, I've known some doctors, some even veterinarians who they don't tell people what they do because they don't want like the Q&A, at a party. They just want to kind of enjoy themselves And, you know, I mean, you're probably gonna encounter that a little bit more if you're out and about, you know, in your community, just being who you are now with this.
For sure. And I was that guy.
Yeah.
I was exactly that guy, but we're now just getting to the reach where, you know, we were flying home from Boston last week and, you know, I was stopped in the airport and recognized and people wanted to ask questions and what have you, which was great. I was happy to do that. But, you know, a year and a half ago, I would have been horrified if that had occurred. I don't even have MD on any of my credit cards.
Yeah. I was just going to run down a couple of some of the videos that I think people should check out because they're just interesting. You talked about Viagra. Did you know this about Viagra? That's going to be a clicker. Stop using mouthwash and why. Is red wine good for your heart or not? How to stop the hiccups. I think everyone wants to know that. Why nose breathing is better than mouth breathing. And that can, you know, if you're running, if you're working out, that can also be beneficial, and you explain that. Why you don't hear about heart cancer, that's interesting. And also, I love this, my son who's now 6, he was freaking out the other day. Why do body parts fall asleep? You know, the pins and the needles, the sensation, and you have a video about that. So yeah, there's really great content, and I'm so glad you joined me today. Dr. London, I really appreciate your time, and I hope that the folks, you know, if they enjoyed our conversation here, will check you out on some of your social media channels and keep doing what you're doing because obviously it's working right now.
Well, thank you so much. I really appreciate you inviting me on, and I appreciate you sharing your personal story as well because I think that's what a lot of people should know. Like, none of us are going at this alone, right? We're all just trying to squeeze as much juice out of this precious life that we've been blessed with, and we're all doing it together. And so I think when they hear your story and they hear my story, it brings these forward in our minds to really respond to the way we feel and to be thoughtful about how we treat our bodies. And so thank you so much for giving me the opportunity to visit with you today. I really enjoyed it.
Yeah. Thank you so much. I really appreciate it. Thanks for your time. Awesome. Thanks for watching this episode of The Curious Bee with Ellen McNamara. We have a lot more episodes on Fox Local.